Hello, I'm Dr. Aniketh Venkataram, consultant plastic and aesthetic surgeon at the Venkat Center for Aesthetic Health, Bangalore. I'm a trained plastic surgeon with a MCH in plastic surgery from Bangalore, and I've done advanced training in aesthetic surgery with fellowships in Belgium, USA, Taiwan, Dubai, and Istanbul. My area of expertise includes all aspects of cosmetic surgery, facial plastic surgery, particularly rhinoplasty, breast and body contouring, especially liposuction and gynecomastia. Let us talk about the Brazilian butt lift. How you can have a more fuller and well contoured buttock. Now, what exactly is a Brazilian butt lift? It's quite a catchy title, but this procedure is actually started in America. Basically, it refers to the procedure of doing liposuction to remove fat, typically from the abdomen, and injecting that fat into the buttock. The aim is to get a nice hourglass figure with a buttock enhancement and a buttock that is fuller and more shapelier. How is this different from implants? Well, in an implant, we are using material made out of silicone. It is typically something like this. This is a breast implant, but a buttock implant looks and feels the same. So, we're making a large cut and we're placing the implant into the buttock. This is the way it was done for many years. But implants came with their own issues. They could get infected, they could move left or right. You might have to change them out after a few years. The complication rate in the surgery is a little bit higher. So, that's where fat transfer became the dominant method. So, how is this procedure done? Well, we make a few small holes in your tummy and we suck out the fat using liposuction, and then we make a few small holes and inject this fat into the buttock. And the way to do this is to get a good contour. You want to create a hollowness above the buttock and below the buttock, and you want to fill out the buttock. How long do these results last? Well, these results can last many years if you take care of it. Remember, fat is a living material. If you gain fat, this fat can increase. If you lose fat, this fat can go away. So, how long it lasts kind of depends on your health and your general condition. So, how is the procedure itself done? Well, at the Venkat Center, we do this under local anesthesia. We do it this way because it makes the surgery very safe. Buttock augmentation has also gotten a bad name in the last few years because there have been a few incidences of death happening from this surgery. How does this happen? This happens because in the buttock you have the fat and then you have muscle below it. People are injecting this fat both into the fat layer and into the muscle layer. I was part of a study in the US that found that you should not inject fat into the muscle layer, because what then happens is that fat goes into blood vessels which can travel to the heart. This is called pulmonary embolism, fat embolism, and this is how people were dying. So what we do is we make sure that we have to inject the fat only into the fat layer and not into the muscle layer, and this way the surgery is done safely. I was part of a team that found this out. Till date, there has been no death when fat has been injected only into the fat layer. And to ensure that we inject it only into the fat layer at the Venkat Center, we do this surgery only under local anesthesia. Because what this means is we give anesthesia only to the fat layer, the muscle layer below is not anesthetized. So, even if we touch that muscle, the muscle contracts and it doesn't let our cannula go inside. This is how we can be certain that we are not injecting any fat into the muscle layer. So, the other advantage of this is that it makes this procedure much simpler. You come, get the procedure done, go home the same day. You walk into the OR, you walk out of the OR. You have to come for 2 days to get some dressing changed. For a week, you have to take it easy in terms of not sitting on your buttock directly. So, it is kind of good to work from home. You can go back physically to work after 1 week. Now, the next question is how much fat survives? Usually, all the fat that we put into the buttock does not survive. Around 50 to 60% of the fat survives. But for most patients, this is more than enough. If they want a little bit more, then after 3 to 4 months, little bit more fat can be added. Now, how much fat to put? This is where your surgeon's judgment comes into play. Putting in too much fat, making it look very weird and unnatural is not a good idea. At the Venkat Center, we look to give a natural result. What do we mean by natural? By natural, we mean that no one suspects that you have had plastic surgery done. It looks like that is your own actual buttock, that it fits your body. And that is where we guide you and we advise you on how to do this procedure. So again, buttock augmentation with fat transfer is the gold standard nowadays. Fewer and fewer people are doing implants. All things considered, fat transfer is safer, provided you do it in the way that I described. Doing it safely, doing it only in the subcutaneous plane, and doing it under local anesthesia helps us to achieve this. I hope these answered some of your questions.